Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, in yesterday's emergency proclamation, Prime Minister Mohd said that emergency ordinances can be used to enact the cover of the use of private property of private hospitals' assets. Now, that means the government can temporarily take over land, buildings, or properties of private hospitals, or to request the use of private hospital resources to treat COVID-19 patients. So tonight on the show, we will be asking 3 healthcare professionals working in or with private medicine if temporary nationalisation is the way forward. Joining us first, we have Professor Dr. Subramaniam Muniandy, President of the Malaysian Medical Association, better known as MMA. Good evening, Dr. Subramaniam. Now, what is MMA's read of the situation after the government's announcement yesterday? I mean, are you prepared for the possibility of nationalisation of private healthcare assets, even if it is temporary?
Well, good evening, Lisa. The whole darurat that was declared was really to overcome this COVID. This COVID infection is spreading like wildfire, and it is overwhelming the public service hospitals. The public service hospital is finding it difficult to accommodate all COVID-infected cases. So I think the Prime Minister has actually approached the Association of Private Healthcare Hospitals to see if they can help. It is not a nationalization of the hospital, private hospital, but I think they are looking for help from the private sector. And I think the private sector has always been ready to offer any assistance to the public service in fighting COVID. Even the general practitioners are actually ready all the time. They must all be utilized. There are enough manpower to be utilized. So if the government feels that they can be utilized, they should be utilized. And private hospitals should also help, as requested by Prime Minister. I think he is just asking for help from the private sector.
Dr. Subramaniam, this is Sharaad speaking. Was the private healthcare associations consulted in this process?
Hello?
Hello, Dr. Subramaniam, can you hear me? Melisa, I think you might have to ask the question to Dr. Subramaniam.
Dr. Subramaniam, Sharaad was asking whether the Private Hospitals Association was consulted before the emergency proclamation was made.
Well, I don't, because I do not deal with private hospitals, because we have a friend, we have our association president there, that's Dr. Kuljit Singh, but they did meet yesterday. I think after the declaration, the Prime Minister met the association president to discuss the possibility of getting help from the private hospitals.
Okay, so it was after the emergency was announced. Now, you said not to think of this as a way of nationalizing private healthcare, even though temporarily. Then how should we think about this? If you say private health is ready to step up and help again in the fight against COVID-19, why then the need for the emergency and emergency ordinances?
Now, the emergency is really to keep people also in place. You realize that, when this COVID has been going in and out, we have actually have lockdown, then we relax, we lockdown, we relax, we MCOs. But as soon as we relax, the number keeps increasing. And I think there's one other way is apply an emergency ordinance to be able to keep people where they are, follow SOPs, what they should be doing, and, probably get the private sector to do part of the job, so that at least the government sector can do what they want looking after COVID.
Well, the emergency was not necessary for that, since we've just had the MCO announced, and that was to keep people at home and hopefully reduce the number of COVID daily cases. Now, the emergency announced is really about, also resulted in the suspension of parliamentary democracy, which is quite difficult to do it's quite difficult to deal with at this time when oversight is necessary. I just want to come back to the idea to the role of private healthcare in the fight against COVID-19. Where do you see private healthcare coming in? What kind of relationship do you see happening between public and private in the fight in this pandemic?
To me, I think the public, the government must use the private doctors, either in the general practice or in the private hospitals. They can always, if private hospitals are agreeable to offer assistance, they should be able to use those hospitals. Otherwise, we are now doing major screening, and I think our GPs, our general practitioners, are all trained doctors, so they can actually take away the load of a lot of not emergency requiring admissions, urgent admission to be handled as an outpatient, either in their clinics or in the private sector, private hospitals. This is like screening for COVID. I think it can be outsourced to the general practice. I don't see why the government is doing. The people are getting exhausted in the public service, doing hundreds and hundreds of testings, managing COVID patients and looking after prevention. There's a lot of things to be done. And I think the private doctors...
Dr. Subramaniam, can you hear me now?
Yes, yes.
Dr. Subramaniam, this is Sharaad speaking. The question, of course, is that, what kind of compensation will the government be exempt from if they use the emergency ordinance in order to, get the assets or use the assets of private healthcare practitioners? In fact, do assets also refer to doctors, nurses, and auxiliary staff? If the government uses emergency ordinance?
Yes, I think the government will have to compensate the private hospitals because it is an expenditure that the private hospitals will have to incur, and I think government has to incur at this moment in time. Expending money to look after the COVID-infected patients is quite important. So, and therefore, the government should budget certain amount of money to be able to accommodate all of them.
But Dr. Subramaniam, the idea of nationalization is in fact to indemnify or to protect government from such compensation. Isn't it the idea of nationalization, as opposed to having a partnership with the private sector, one about exempting them from exactly these kinds of expenses? Yeah.
You see, the nationalization, which means it's almost like a takeover. But I think that is not always possible because, when hospitals are set up, they're set up with certain aims and things, and they've got a lot of people, not only doctors, they've got the paramedicals, the nurses, the assistants, they all have to be looked after. You can't just say we are doing for free. It's almost impossible. So I think the government has to compensate.
Do you think the emergency and these, such ordinances are necessary when there are already hospital groups like IHH and KPJ that are government owned or at least have a significant government shareholding?
Yeah, but they are. But at the moment, the private hospitals, I don't think they will be actually taking in COVID-infected patients, because when you take in COVID-infected patients, other patients will find it reluctant to visit that center because of the fear of COVID in the present day. Though a lot of precautions is being taken for the private sector to make sure it doesn't spread. There's all been sanitizers. There are also sanitizing the whole building, complete prevention. They're all done. But I think this emergency ordinance here will mean, I think, basically not only the care of the health sector, but I think it also means having people under control. I know MCO was declared, but we have declared MCO a number of times, and now they have declared it in bits and pieces. Six states for CMCO, 6 days with conditional MCO. I really think this will actually confuse a lot of people and will not really work as a full force prevention.
Dr. Subramaniam, thank you for your time. We really appreciate it. We're going to take a quick break here on Consider This. We'll be right back. Stay tuned. Hi, welcome back. You're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. With public healthcare stretched over COVID-19, the government is now looking to private healthcare for help. Is nationalisation, even temporarily, the way forward in the fight against COVID-19? Joining us on the show tonight, we have Nadiah. She's the CEO of Thomson Hospital, Kota Damansara. Nadiah, good evening. Thank you so much for joining us on the show. Now, the justification given by the Prime Minister for the need for the emergency and emergency ordinances was that, if I may quote him, the government can get a more inclusive participation from the private sector, including private healthcare facilities, to reduce the burden borne by government agencies, especially public hospitals, end quote. Now, Nadiah, do you agree that private healthcare's participation in the fight against COVID-19 so far has not been inclusive enough?
I think for us in private healthcare, we have always been very committed to assisting the country in fighting COVID-19. But I think the strategy must have been discussed in a more inclusive manner. In the beginning, we had several engagements with the Ministry of Health. The number of cases, of course, was much lower. And it was generally agreed that we would participate in support by providing widespread access to screening and then refer all the cases to the public hospitals. But I think that we all know that in the past few months, watching the number of cases, many of us have seen that the patients in our hospitals are taking longer and longer to transfer out to the designated public hospitals. And we know that this moment will come. I didn't think that a nationalization would be actually necessary because the private hospitals have never put in a stance that we would not participate, that we would not help. But I think that there are a few structural issues that still need to be addressed and clarified so that people are very clear about how we are going to participate in helping manage the COVID pandemic.
Nadia, when we think of nationalization, because it's something that doesn't happen very often in Malaysia, what exactly will happen? When we talk about assets, are we also talking about doctors and nurses and auxiliary staff? Who will pay them? And can they refuse to participate? I mean, is this a situation where basically the resources of hospitals will be coerced to be used by the government of the day?
I think nationalization is quite a blunt tool to actually engage with the private sector and get the participation. Firstly, we are more than happy to admit the patients. In fact, what we're doing now, and we have in our discussions with MOH recently committed to actually treating these patients simply because they are in our hospitals now. The infection is so widespread. If they come to our doors, we can't turn them away, and we have to continue managing them until we find a bed in a public hospital. That has been the arrangement up until now because the official line was that all COVID patients should be admitted in designated COVID hospitals. And so what would likely happen in the future is simply that we would not transfer these patients to public hospitals. If they arrive at our doorstep, we will have to manage them and take care of them until they are fit for discharge. But I think the key issue now is that who is going to pay for this care? Now, for the private hospitals, we're not looking to exploit this as an opportunity to make a lot of profit, but to be fair to the healthcare workers, which, we will also have to pay a special hazard allowance from the nurses down to the housekeepers. There is some cost that need to be recovered. So I think the key issue here is that we are competent and ready to admit these patients, but who is going to pay for it? Now, typically in private healthcare, the care is reimbursed by insurance.
Nadiah, is cost the only consideration? I mean, you alluded earlier to some structural issues that perhaps need to be ironed out before private healthcare can actually actively be included in managing the pandemic. What other structural issues were you referring to aside from who covers the cost of treatment?
Clearly, it would be the facilities and the manpower. Now, COVID is an infectious disease. We would need to upgrade our facilities in order to ensure that the other people who are non-COVID cases will remain safe. So there's a lot of retrofitting and installing new filters and things that need to be done, but that is can be mobilized relatively quickly. But the other thing is on the competency of the manpower. Now, if we look at the number of cases, close to 200 are actually in the ICU, with a good number of them being ventilated. To care for a ventilated patient actually requires very specific level of training and care, and to be honest, it's a shortage everywhere in Malaysia. That has been a structural issue, the lack of trained healthcare resources. And so we may look at a situation where if the numbers continue to rise, the level of care will go into sort of like a wartime level of care, where we basically forget about subspecialties. We just do general medicine, we do general surgery, and everybody has to be mobilized to take care of COVID patients, even intubated patients. And so this is something that has never happened before, but it has clearly happened in the States. And I have been monitoring what our colleagues have been facing in the United States, and it seems that unfortunately we are following the same trajectory now.
Nadiah, since the kind of surprise announcement of the emergency ordinance took literally everybody by surprise, have you since been able to get some clarity as to what the government intends to do, what the steps it intends to take, and what would your, as it were, feedback be? What kind of conversations do you want to have with the government, and what terms of reference would you like to see laid out?
I think that, first of all, the term nationalization shouldn't be bandied about. Now, the healthcare groups are privately owned organizations. We have shareholders to answer to. And when you mention nationalization, that does have an impact on, our contractual obligations to the banks and other considerations, which perhaps may have not entered the conversation because everyone was just focused on mobilizing resources, really. But I think to use the word nationalization is very dangerous because it has other implications on the financial markets and the business side of it. Now, if we talk about committing the resources, I think that there's a much better way to have that conversation. It is simply that all of us need to assess at what capacity we can function. There needs to be a discussion about the reimbursement of the care. There needs to be a discussion about isolating those patients who are less sick at home to free up critical hospital beds because we don't have enough. I think the initial strategy of quarantining everyone in a healthcare institution to stop the spread, I think that that time has passed.
Right. Nadiah, thank you so much for joining us on the show tonight. We really appreciate your time. Thank you for sharing your insights with us. We're going to take a quick break here on Consider This, but more in just a couple of minutes, so stay tuned. Thank you so much for staying with Sharaad and I on Consider This. Let's continue our conversation about the possibility of an emergency ordinance allowing the government to temporarily take over private hospital assets. Joining us now, we have Azrul Khalib. He's the CEO of the Galen Centre for Health and Social Policy. Azrul, good evening. Why do you think the government raised the possibility of co-opting private healthcare assets as the basis for declaring this emergency? We spoke to Nadiah, one from Thomson Hospital a little bit earlier, and she said to be very careful about using the term nationalization. But since that's the term that's been used, what do you think? Why do you think the government raised the possibility of nationalization private healthcare assets?
Well, it is possible, Melissa, that the government is anticipating a significant influx in the reported cases within the next couple of weeks that is beyond the numbers that we are seeing at the moment. Yesterday, it was around 3,309 cases, I believe, and based on existing models and projections, it could easily reach more than 5,000 in the weeks to come. So basically, what we're seeing here are the resources and capacity of the government at the moment not likely to be adequate enough to handle the influx. Now, I would echo similar sentiments as Nadiah, that I wouldn't necessarily use the term nationalization in the permanent sense, but the government is certainly looking to gain the use of private sector resources temporarily. Maybe they should be termed public-private partnership, but there really is a need to to use legislation if that was the case, but hopefully this partnership will be done with some form of compensation or funding involved. So really what we're looking here is a necessity to adapt to an evolving situation, which requires a little bit of out-of-the-box thinking. I can imagine that it was a shock very much for everyone in the private healthcare sector to hear that announcement made by the Prime Minister.
Azrul, maybe the government uses the word nationalization because that's exactly what they intend. And I want to draw your attention to something that Dr. Kevin Yee, Member of Parliament for Bandar Kuching, said, that he said the Association of Private Hospitals of Malaysia, APHM, has been proposing a public-private operational arrangement for some time now. And he says it's been largely ignored. There's been no little response from government about the private-public partnership. So what is happening here? We have on one hand some willingness of the private sector to enter into a kind of partnership, but government has been reluctant. And now they talk about nationalization.
So, I totally agree with Dr. Kelvin there. I mean, when you look at it, this is something that APHM, as well as a whole group of, not only just APHM, because private healthcare involves more than just private hospitals, but also GPs. They have been extending their hand in cooperation and collaboration to the government from the very beginning of last year, which was a year ago since this outbreak occurred. But the government has been quite involved in this whole of government approach, which basically saw them taking on the burden of the public health response entirely on their own shoulders. And we've emphasized many a time that it's not necessary for the government to take it on upon themselves wholly with regards to managing this outbreak. It is possible to involve private hospitals, especially using their beds and ICU units, to be able to complement the existing resources of the government. So today, when we come to this situation where, seemingly by fiat that this is being done rather than through the collaboration that has and willingness that the private sector has been extended, is quite of alarming development. I think it was totally unnecessary for that to be mentioned in the announcement, and certainly I don't foresee any kind of resistance or opposition by the private healthcare sector in wanting to work with the government on this, especially when it deals with patients who are non-COVID, looking at treating patients who are able to move from the public sector to the private sector so that they can relieve their government counterparts from the pressure of also dealing with those patients, so that they can concentrate on what they do best, which is dealing with a public health emergency.
Well, Azrul, you've pointed out before that increasing the involvement of the private healthcare system, and I think you pointed to GPs specifically. You said that GPs, perhaps it's part of both diagnosis and treatment of COVID-19. That was a recommendation made many months ago. Why do you think that those recommendations have not been taken on board, have not been listened to, fallen on deaf ears, and now we've come to this, to the possibility of, an emergency ordinance for a temporary takeover of private assets?
Well, this is something that's quite of a disappointment, really, because the general practitioners, considering themselves also small businesses, were wanting to take on this burden, not only to help out the government, but also to keep their clinics afloat, really, and to be able to extend the coverage of testing and screening that at that point of time was solely dependent on government hospitals and facilities to be able to carry that out. And imagine what would have happened if we were to have mobilized them much earlier. It could have made a world of difference in the way that we understand the outbreak today, and would actually help relieve some of that stress and burden on the public healthcare facilities. Today, you have a government system that is overstretched. It is dealing with a lot of fatigue. There is a lot of burnout, and the government is still behaving, up until recently, as if there was no problem with regards to that burden and the strain on the healthcare system. And suddenly, out of nowhere, there is this ordinance being proposed, which basically, I call it requisitions the private healthcare facility to an effort which they could have been part of many months ago. Now,
Azrul, very quickly, we just have like less than a minute. Your thoughts on whether the government is listening to healthcare experts. In that open letter to the Prime Minister, they suggested many things, including a independent COVID task force that would have included the Malaysian Public Health Physicians Association, Association of Private Hospitals of Malaysia, and so on and so forth. Are they listening to experts?
Well, we have our own experts in the public health sector, but we've seen from other countries, especially our neighboring countries like Singapore and Thailand, Indonesia, and also when you look at UK, US, is that you need people from outside the public healthcare government facility too. You also need those who are in academia, from economics. You have to have a group of people who are able to give the best possible advice looking at the different issues affecting people. Right now, when you look at the response, especially from the public health perspective, it's only looking at the disease. What we're not looking enough about the people. How are these policies affecting people? And as a result, you don't have enough cooperation from the public, you don't have enough support, and we are where we are today because we didn't have enough voices around the table to advise the Ministry of Health, especially on what to do. And this is something that needs to change, especially since we're about to roll out the vaccines in the very near future. And that vaccination effort needs to also involve the private healthcare sector. You cannot have just the government doing it if we are to be able to vaccinate as many people as possible.
Azrul, thank you for joining us on the show tonight. We really appreciate your insights. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching, and good night.